Evidence-based therapy is really therapy that's based on science. It's based on what science tells us works to help people get over problems. The science that is used to vet psychotherapy and therapy treatments is based on something called a randomized controlled trial, where you have people getting the treatment and then you have people not getting the treatment, and we compare those two groups to find out whether the people getting the treatment are actually significantly better than the control group, the folks who didn't get treated. And the randomized controlled trial is the core of empiricism. It's the core of what it tells us what works and what to do or not to do as a therapist. The problem with psychotherapy is that so many therapists don't operate on the basis of science or evidence-based therapy. They don't read the literature. They simply do therapy on the basis of what they learned in graduate school. And the kinds of therapies they do become more like religion than science. A deep belief that this is the way people heal and this is the way people get better. But unfortunately, no real evidence that it works. There is absolutely no evidence that the therapy of Sigmund Freud, psychoanalysis, actually works. We don't have any evidence of that. In fact, when there was an attempt to do some research to validate psychoanalysis, it was suppressed because it showed no effectiveness whatsoever. And so this is a problem, and it's one of the things that we wanted to address at New Harbinger. We wanted to give people tools that were based on science, that were based on evidence of what works, that had been proven to be helpful and effective, as opposed to inspirational programs and encouraging people or giving them complicated explanations of how they got sick that don't actually help them get better. So we wanted to focus on what science tells us works. For example, there really is no evidence that psychoanalysis works. And there's no evidence that the basic principles of psychoanalysis, that children are sexually attracted to their parents in various ways, there's no evidence really that that is true either. This is something some 19th century guy dreamt up and then built a whole treatment paradigm on top of it. And so we're actually concerned about helping people who have problems that they struggle. For example, PTSD, it's a huge issue. There's an enormous amount of childhood sexual abuse throughout the world. And there are treatments that help people with this. What did psychoanalysis do? Psychoanalysis came along and said, no, those children actually didn't have abuse. Those children made it up. They wanted that experience, and they actually made it up. And their psychodynamics are based on wanting something, and the results are that the therapist has to sort of talk them out of having had that experience. I mean, this is the kind of stuff we have in our profession. And we wanted to have a treatment for post-traumatic stress disorder that actually science tells us how it works and tells us why it works and shows us efficacy outcomes that really help people. It's very interesting what's happened in behavioral therapy. It started with, Watson and Skinner saying, look, we're gonna help people change their behavior, their observable behavior, and we're going to reinforce new behavior that's more effective, and we're going to discourage behavior that's ineffective. And so the very early principles of behavioral therapy were all focused on behavior you could see that was obvious, and there was very little attention or interest in what goes on inside of people's heads. Then came the so-called second wave of behavior therapy, which is cognitive behavioral therapy. And CBT was saying, well, look, not only do we have to help people change their behavior to be more effective in the world and to learn how to do things they didn't know how to do before. People have skills deficits. But we also have to take a look at how their emotions are generated, that actually the things that they think about impact how they feel. So that when they have thoughts about how someone has damaged or disadvantaged them, that actually triggers anger, and that there's a relationship between thoughts and emotions. So that's the second wave of behavior therapy. And if we can help people change their thoughts, we can help them change very painful emotions. Now, the third wave of behavior therapy came along and has been very influenced by Buddhism and Buddhist technologies. A key tenet of Buddhism is that we learn to observe experience rather than resisting it, rather than trying to suppress it, push it away, get rid of it. We learn to watch ourselves, at our thoughts, our feelings, our reactions, even our physiological experiences. We watch them through mindfulness. And the third wave of behavior therapy came along, and acceptance commitment therapy is one of the kinds of therapies that have been developed. And their message to clients was, look, you've been trying to fix yourself. You've been trying to change and suppress these painful thoughts and feelings. And what if we turned and observed them instead of resisted them, and started to learn how to watch experience instead of trying to suppress it and push it away? Maybe that would change how you feel. That would change how you live. And instead of trying to spend all of your time resisting experience, getting away from experience, what if you put your attention on your values and how you want to be in the world instead of what you're trying to avoid? So the third way of behavior therapy is using Buddhist technology to help people change their relationship to pain. I think what's going to happen is we're going to see an amalgamation of some of these therapies. You know, we have quite a few different third wave therapies. We have MBCT, mindfulness-based cognitive therapy, MBSR, mindfulness-based stress reduction. We have ACT, acceptance commitment therapy. We have DBT, dialectical behavior therapy, and a number of others. And these therapies have been developed with somewhat different perspectives, but all with the common thread that we can observe experience rather than resisting it. And I think what's going to happen is we're going to see these therapies starting to flow together. And we're going to start seeing component analysis of the different pieces or the different steps or parts of these therapies to find out what works best. And then we're going to find that those components or pieces of the therapies that work best get put together with other ones into one grand treatment process. So we're going to see a movement away from named therapies and toward modules and components that are targeted to specific kinds of problems. The second thing we're going to see is a movement away from symptoms. The whole DSM is done. Diagnostic and Statistical Manual, and separating people into these particular diagnoses. It's over. The NIMH, National Institute of Mental Health, has just stopped funding research based on diagnoses. And what they're saying is, no, what we want to do is fund research based on what really drives the problem. What is the underlying cause of the problem? Let's formulate and figure out what's actually causing these problems. Forget the symptoms, forget all these categories. Let's find out what causes the problems, and then let's treat that. And that's where we're going to move with third wave therapies, a movement away from symptoms and away from those kinds of categories, and a movement toward understanding what really is the underlying cause. And we're seeing a movement toward that, and those are called transdiagnostic mechanisms, meaning they're not just about one diagnosis, they're about what drives all of these different symptoms that show up and get separated into these different DSM categories. New Harbinger has financed a number of different randomized controlled trials looking at the usefulness of our books compared to control groups, people who are not getting treatment. And every one of those trials has shown that our books are efficacious, that they help people get better, that the effect size, that how much people improve, is very significant and actually very close to the effect sizes you get with psychotherapy, where you're sitting face to face with a therapist. In fact, a recent study that was done on a book on mindfulness and acceptance for anxiety showed that the effect sizes, the actual impact of the book, were better than some of the face-to-face therapies that are available for anxiety. So it's interesting. Books are very viable teaching tools, and people get tremendous value out of them. And you know, the going rate for psychotherapy now is anywhere between $140 to $210 an hour. Our books usually sell for less than $20. What a bargain. And not only is it a bargain in terms of the cost, but it's a bargain because it provides evidence-based treatment that many therapists don't offer their patients.